Okay, so now I would like to start first with the video clip. It's about the West Nile virus. Remember we talk about the beginning of public health and what is public health on its own as a profession. I would like that you observe this video clip. See if there are any mistakes maybe were done that we could learn from that, and of course public health professionals, they learn from that. And also something that you will see here and thinking, oh, maybe this could be done really differently, or something like, wow, I didn't know about that, and we should maybe educate the public, that the public will be much more aware about that. So I think now we can start with the video clip. Should be downloaded and working.
Tracy McNamara had the job of her dreams. As lead pathologist at the Bronx Zoo, she could oversee the health and safety of hundreds of rare and endangered species. But little did she know she would soon become embroiled in a mystery that would bring New York City to the brink of panic. It all started with the crows.
Crows were falling from the skies in large numbers. I mean, literally, these things were taking nosedives into the exhibits. These things were just dropping like stones.
For over a month, New Yorkers have been noticing the dead crows all over the city, but no one paid much attention, except a concerned Tracy McNamara.
We were worried immediately that whatever was killing these birds would spill over into our captive population of endangered species.
What McNamara didn't realize was that something far worse was happening beyond the zoo. 10 miles away at Flushing Hospital in Queens, patients were being admitted with a mysterious infection that was causing their brains to swell. Dr. Debbie Asnes was at a loss to explain their symptoms.
The first patient came in with fever, nausea, and vomiting, and needed to be on a respirator. Within 2 weeks, we had 4 additional patients with the same problems.
Several of these patients became paralyzed, and 3 died.
I was tearing my hair out trying to figure out what was wrong with these patients.
Asnes feared she was seeing the outbreak of an exotic new disease. She asked for help from the city's Department of Health. Was there anything the victims had in common that could explain their mysterious illness?
We asked every question we could think of. Had they shared any common exposures, any foods, any restaurants? Couldn't really find anything, except all of them did seem to like to spend time outdoors, and particularly so in the evening.
It wasn't much to go on, but officials wondered if another creature that comes out in the evening could be responsible. The mosquito. The city dispatched a team to canvass the area where the patients lived.
This team came back saying there's lots of mosquito breeding out there, and it's quite possible that this could be related to transmission of disease.
But it was a remote possibility. There hadn't been a mosquito-borne epidemic in New York for over a century. This dense, concrete jungle hardly seemed the place. But just to be safe, health officials had the U.S. Centers for Disease Control test samples from the Flushing patients. As New York waited for an answer, several more people were stricken with the disease. And at the Bronx Zoo, a similar tragedy was unfolding among the animals.
All of a sudden, we now had a flamingo that was having difficulty moving around. We had a beautiful snowy owl that had eaten breakfast, boom, found dead an hour later. This thing was just taking out everything in its path. And we felt so powerless. These were individuals we all knew and loved.
Desperate to find out what was killing her birds, McNamara and her team examined brain tissue from the victims.
When I looked at that first slide, it took my breath away. It was the worst encephalitis I'd seen in 18 years as a comparative pathologist.
Encephalitis is an inflammation of the brain, a condition similar to the one affecting the Flushing patients. But no one yet knew of this coincidence. And no one knew what was killing the people or the birds. At the CDC, the results were in. Tests indicated that the human victims were suffering from a rare illness called St. Louis encephalitis, a disease carried by mosquitoes.
An outbreak of the mosquito-transmitted virus encephalitis has claimed
Suddenly,
second life.
New York was under siege by an insect.
An 81-year-old female from Flushing, Queens, but she's doing well and she's out of the
The
hospital.
mayor ordered whole sections of the city sprayed with insecticide.
I think the best thing for people to do is not to panic.
When Tracy McNamara heard what was causing the human deaths, she couldn't ignore the similarities.
A bell went off. A scientist isn't supposed to jump to conclusions, but I felt quite strongly that there was a link between the birds and the human deaths. And that very day I wrote my will.
There was something troubling about the CDC's diagnosis. McNamara knew that birds can't get St. Louis encephalitis. So if the same disease was killing both people and birds, it had to be something else. She urged the CDC to examine her bird tissues. But in a world where public health seldom pays attention to veterinary science, she was turned away.
Birds really didn't fall under the mandate of the USDA or the CDC. And because of that, we sort of slipped through the cracks.
McNamara sent her samples to a veterinary lab. When researchers found a type of virus never before seen in North America, an alarmed CDC joined the investigation. And they soon discovered that McNamara had been right. The virus that was infecting birds and humans was not St. Louis encephalitis, but a closely related strain from Africa known as West Nile virus. How it got to New York, no one knew. But if officials had been more alert to the potential connection between the dying birds and the human cases and begun spraying sooner, lives may have been saved.
The fact that the disease had been announced by wild crows well in advance of human illness, and we missed the diagnosis, illustrates if there had been an opportunity to intervene, it was lost, and for no other reason than the alarm was sounded by a bunch of crows.
The outbreak in New York stopped when cold weather brought an end to mosquito season. But not before West Nile virus had infected 61 people and taken the lives of 7. And New York was only the beginning. Infected birds carry the virus wherever they go. And if they're bitten by mosquitoes, the insidious cycle of disease will continue. A mosquito sucks up the West Nile virus along with the bird's blood. If the mosquito then bites another bird, or a different animal, or a person, the virus can be passed on and on. The mosquito is the go-between, the delivery agent, the vector of disease. On the wings of infected birds and mosquitoes, West Nile virus spread relentlessly across the United States. In just 4 years, it killed countless animals and infected 14,000 people. Over 500 died. Nothing could stop it.
Okay. So, did you recognize the voice who was talking? Yeah, okay. So, yeah. Brad Pitt. Yeah. Okay. So, what we could learn from this video clip? Any ideas? They mentioned that what can we learn from this? what is quite important for you as a public health professional? Yes?
Like assessing a situation and kind of figuring out where a disease came from?
Yeah, exactly. So also to observe everything. So, to be all the time aware, all the time observe if there could be any connections. Sometimes I have the students that they are from the major of criminology. So I told them, well, public health, it's like detective work too. You have to find out what are the connections and observe everything, the location, and see if there are any connections between different things. Also, when you are probably reading the book too, you find out there is also the profession to be veterinarian with public health, part in that. So it means that the veterinarians, they are not just, treating the animals if they are coming to their office, but they are also trying to find out immediately if the animal is coming with specific sickness, or they try to make the notes and try to find out if there could be any correlations, and making also the report to public health department. So it means it's like the surveillance, being aware about these possibilities. Another quite hard explanation was here about the CDC, that the CDC refused to have more cooperation with that. So it's also necessary to change that a little bit in the way, and it changed through the process to be more aware from your surroundings. So as your classmate mentioned, yes, to be sure that what's going on around you and making the connections between that, and observe why it's maybe this problem or this situation, is it something that will be maybe correlated later. So it's very important. So that's and actually when we are going now to epidemiology, so this is part also like observing, checking if there are any correlations, making the trend. So that will be part of the epidemiology. Did you like that video clip? Did you think this is actually part of public health also? So you can see it's not just hygiene on its own, it's not just sanitation on its own, it's not just the politics and justice and all of that. It's also this part that will be, and you remember when we had the last week on Thursday we were talking, or even before, we were talking about different disciplines in public health. So epidemiology is one of them. So epidemiology is one of the basic science in public health. I don't know why it's not moving. Okay, now it's moving. Epidemiology is one part, what you can see here, investigating causes of the disease. So if you go back to that video clip that you were able to see, so it was trying to find to find the cause, to investigate the problem. So that's part of the epidemiology. Part of the epidemiology is also to find and diagnose the disease. You will learn also very important questions in epidemiology that I will show that to you later, that needs to be questioned in order to find the agent that can cause the disease, the way of the transmission, way of how we can diagnose that, if there is any correlation with something else, how the disease actually, it's the action of the disease. And also another very important part is the trend. So it's not just correlated to find the disease, but the trend also, in case we will see consumption of the green tea, it's helping public to decrease the risk of cardiovascular disease or development of the cancer. So if we see the trend based on this epidemiologic process, we can start to recommend, yes, people should consume green tea. So part of the epidemiology, it's very, very important, is the observational science. So if there will be some questions on the midterm about what is epidemiology, and I have also 2 short video clips that I will show you about epidemiology. But this slide, it's quite important to know about the basic information about epidemiology. The trend, this is something what I mentioned to you before, to see also which direction, if something it's correlated, and if you see more and more research studies in that direction, and you eventually do the analysis of many of the research studies, and you realize, well, this is the summary of many of the research studies showing, yes, if the person are consuming this type of the nutrition or this component, and it's possible to see like primary or secondary prevention, why not to recommend that now at this moment? So all the things like now you can read also in the literature, or you can read it just in any of the magazines, and you see like, well, there is the correlation between vitamin C and that type of the disease, or green tea, as I mentioned to you, or pomegranate juice, or anything. So it's based on that epidemiological studies. So it's the trend. So epidemiology, here are the questions. If somebody will wake you up in the middle of the night and will ask you the questions, what kind of questions you need to ask to find out, you know, what is the diagnosis of the disease and what are the problems, the question will be who, when, and where. Okay, of course we have additional questions, what, and so on. But these crucial 3 questions are very, very important in epidemiology. So if you will not remember too much from epidemiology, I hope you will always remember these questions. So it means who is getting the disease? If you go back to West Nile virus, who was getting the disease? It's also associated, for example, when we try to find out the most group of people that they are sensitive to the disease. So it's also very important to find out who should be vaccinated, for example, for the influenza or for the flu. Is it young population, older population, or also who is getting the disease, because maybe there will be the center from where the disease, you know, it's coming and will be spreading. So who is getting the disease, when did they get the disease? So it's very important if there will be correlation and you would like to find out like E. coli or any infectious diseases. So when and where is the disease occurring? So that was also, it was possible to you to explain through the video clip, yes, this was from, you know, West Nile virus, it was coming from Africa. So they are most important things, questions that you need to ask in epidemiology. You need to do epidemic surveillance, so you need to find out what is the spreading of the disease. You need to find and learn the word notifiable diseases. You have that in your textbook. There is the whole section about notifiable diseases. Example of the notifiable disease is hepatitis A, for example. Or so it means there are some type of diseases classified that they can spread very quickly. If what is the definition of the notifiable disease? Who is reporting that? Always the physician. If the patient is coming to the physician office and they found out, yes, this is the disease that is under the umbrella of notifiable diseases, physician immediately needs to inform the public health department. So that's this group. You also need to find out if maybe that will be new disease, like what was happening, you know, on the video clip. So they were not sure, like, oh, maybe it's this type of disease, and then realizing, well, it's something else. So that's also report and doing the surveillance, because you would like to catch the diseases as soon as possible before it's completely spreading of the disease. And epidemic surveillance, of course, it's also very important in the situation of bioterrorism, because you would like to do the surveillance and to provide actually the primary prevention. So if there will be the questions on the midterm about the, you know, epidemic surveillance, so you know what is connected with that. It can continue additional things that I already mentioned, the notifiable diseases. Please also remember many of the names of the notifiable diseases, but also the definition about that. When is the outbreak investigation? Who is behind that? Epidemiologists. So they, of course, what's very important to do is to verify the diagnosis. And they ask these questions that I was showing that to you before, and they are trying to find out, you know, what is the plan. So if, for example, in the specific location now suddenly it's the occurrence of the notifiable disease, the specific type of disease, so immediately it's necessary to make the connection with that patients to find out from where they were coming, with whom they are in the contact, because each of the disease has also incubation period of time before there are the symptoms, the disease. So if we have the vaccination, we would like to use that incubation period of time to provide the vaccination so the disease will not occur. Or also you would like to find out if these people were in contact with other people, where the other people moved, because you would like to spread, prevent the spreading of the disease. So it's also very important providing these specific questions and contact with the population. This is just an example, and you can see that from time to time in the newspapers and magazines. I believe this was like 2006, that was the problem with E. coli. I don't know if any of you remember that. It was a few years back. And so you can see sometimes there is the report like, yes, this type of food was taken from the shelves. If there is the problem and the patients are brought to the medical facility and it's under the notifiable disease, as E. coli is immediately important to find out what is the common denominator. And to get the common denominator is, of course, you will ask that question that I told you before. And if you find out, oh, maybe that is the salad, that you have to take that out of the shelves to prevent that it's from the spreading of the disease among more of the public. And you need to find out also how this disease or how this pathogen was able to get to this product. So you investigate and you try to find out who is preparing these packages, where is the whole process, where is maybe the farm, what is the location, what other things could be involved in that. So you really need to go from this point that the person is coming to the hospital and it's sick to find out what was the etiological factor in the beginning. So that's actually part of the epidemiology. So far, we were just talking about infectious diseases. What you saw on the video clip was infectious disease. But chronic diseases are also part of the, you can use the epidemiological process and the surveillance also for chronic diseases. Quite known and famous is the Framingham study. Based on the Framingham study, before 1948, people didn't know, like, is it possible or are there, they didn't know any correlations with the cardiovascular disease, like, for example, high level of the cholesterol, high level of the blood pressure. So they didn't know that that could be correlated. So therefore, when we do the studies and we find out through the prospective studies to find out, yes, maybe after 10 years, if the people are engaged in the specific, health behavioral, or through the process what they are, of course, eating, or just the process they are exposed to the environmental components, that could influence that now, yes, this is the person diagnosed with heart failure, and it's correlated with additional components in the body. So before 1948, they didn't know that, yes, the regular screening for high level of the cholesterol. And we can see through the process there are more and more different laboratory tests showing there are more correlations with cardiovascular disease. We know now homocysteine levels are correlated, or when you will have the guest speaker on Thursday about the diabetes, so we have different correlation with that. Now we know tobacco is also increasing risk for symptoms of diabetes. So this is the process, this is the epidemiology again showing you what are the correlations. So not just the definition on the disease on its own, but what could be the etiological factors. So epidemiology on its own, it's quite fascinating field. You really do the detective work and you are trying to find out what is behind that disease. So you don't look just like, oh, now I have this disease, I have the high blood pressure, and that's the symptoms, that's the diagnosis. But what is correlated? Why the person has the high blood pressure? And if that high blood pressure is correlated with additional cardiovascular disease. So this is the epidemiology behind that. Of course, there are additional studies showing, yes, this is the process. There is the correlation with smoking and development of lung cancer. So now, of course, we are 2012, and it's obvious there is the correlation with tobacco and the lung cancer. But before 1952, they didn't know about that. They were thinking, they tried to do more and more research, and showing the studies that if there is any correlation. So something what we know now was not known, just a few years ago. So lung cancer, I already started. I was a little bit ahead before the slide. So it started actually with the questionnaire, and mostly it was the prospective type of the study. So you have the group of healthy people, and you are reporting and you are describing and making all the surveillance and surveys also and blood measurements, and you are doing that periodically and observing and checking if they are continuing the specific behavioral, if this can influence that behavioral on that outcome of the disease or outcome of the health. So if you look on that slide and you see information written here about increase the risk for dying from the lung cancer or being diagnosed with lung cancer, so all of this came from the epidemiological studies. It's quite already known correlations between the lung cancer and cigarette smoking, but through the studies, through additional studies, we know now that could be also correlated the smoking with increasing the risk for diabetes, increasing the risk for cardiovascular diseases. So again, if you look in that time, it was not yet completely known, but now through the studies we can see that. The heart disease, this is something that I already mentioned to you before. So again, this started the process to see if the people have the cardiovascular failure or the heart attacks. So we can also do studies and going back, so retrospectively, to find out what was going on, what could maybe influence that now at this age the person has the heart disease. So this is, everything about that, it's correlated with epidemiology. So you can see if there will be the questions, are we using the epidemiology just for, finding the trend in infectious diseases? It's not. It's also for chronic diseases, for any type of the behavioral modification. Public health in the news. The previous one I was showing to you about the E. coli. This was the AIDS epidemics. If you look on that, it started from some kind of situation that was not knowing that maybe this is actually the HIV or immunodeficiency syndrome. It started back 1981 with very rare cancer, Kaposi sarcoma. And so this is also the beauty on that public health and on epidemiology, that after that you have to follow up with that situation. So who would be thinking that suddenly rare occurrence of cancer will be actually leading to finding out, yes, this is connection with HIV. So this information can give you like the alertness, yes, I need to be aware about some kind of correlations of something like, and follow up different situation. So you can it started with the sarcoma. Now if you go back, it's quite clear, because if we have low immune system function is connected with the development of different type of the cancer, or it's correlated with development with more infectious diseases in the body, like the different forms of pneumonia. So it started actually in that process, and then later was, by the laboratory tests and additional tools, was possible to find out, well, there is the lower function of the immune system, and eventually making that statement and the diagnosis and the name for the new type of the disease that was developing here. So this is again based on that example. I know when you will have the epidemiology as a class on its own, you will go much more into detail of that. This is again the introduction to public health, but I would like to show you this is the work of the epidemiology. This is the work of public health. So if you find out correlation like this, immediately you need to notify the public about that and to find out how we can prevent that or what we can do about this. So that's the public health work on its own. You also need to do, the message to the public about the education, how to prevent the disease. Remember, we are doing primary, secondary, and tertiary prevention. That was also the time that was the higher risk. Suddenly, there was some kind of protocol was developed, like who probably can get the disease. But suddenly, after the protocol was done, people they didn't fit to the protocol, and they have also were infected with HIV. So that was the time that was discovered that was the infectious process was done through the blood transfusion. Now you have completely different population. So through the process, step by step, it's really detective work. Now you are thinking, okay, that can be transmitted through the blood. So I have to do, as a public health provider, completely different recommendations. But then it comes the time that suddenly public will panic. You would like also decrease the panic situation among the public, in outside. So you have to come again as a public health provider and make that education and find out, yes, this is the correlated with this specific approach and activity, but not with other one. So otherwise it could be quite a panic situation. When we talk, actually, if I'm going still a little bit back to that, in that time was like very around the 1983, 85 was really very strong panicky situation that nobody, if somebody was already diagnosed with HIV, they even didn't want to shake the hands with that person. So it was really, but we already know that through the shaking the hands, it's not transmitting the disease. So what do you think? What can you do about that as a public health provider? Just tell me that. What do you think? What do you do? Yeah.
Well, first, obviously, you find out that, what are the actual real ways of actually transmitting the disease, and then you actually educate the public and you let them know that, obviously not through hands, it's, through needles or sexual contact. So it's important to educate the public so you decrease the panic also.
Yeah, so this is excellent, response for that. So you can do that as a public health providers. You can do that probably as a Surgeon General, because this is like, if you have this information, if you will start on the local level, it will take forever. You need to think from public health perspectives how quickly to give that information outside. So you probably, like the representative of the health ministry in different countries, they probably have to go out and to talk about that. Also, like Surgeon General, he need to talk, he or she need to talk out and to talk about this one. In that time, you can also pick up some kind of very important person that everybody knows, or and so it can be some kind of celebrity also. In that time, actually, this was amazing work. What, if you remember, the late Princess Diana from England, so she was actually helping in that way that she went to the hospital and she was shaking the hands with patient with HIV. And it was amazing. That was like a really crucial moment that in that time, because everybody saw her and everybody realized, well, and then based on this, started more information from the public health providers. Yes, there is no risk for shaking the hands with HIV patients. So that helped. So I'm a little bit touching here like public health cases when you will be in winter in that class, but this is the situation also like that. So you have to think how quickly and how can be the influential person may be correlated with the scientific part of public health to give the information to public. So additional public health in the news. So you also have in your textbooks many cases. So this is another example of problems that was correlated and connected with public health. So this was the problem that intestinal flu. Suddenly, a lot of patients were coming to the hospital. Mostly it was like students, school teachers, and of course the hospital's employees. So if you think about the students and school teachers, I know it's already described here the scenario, but if you think about the students and school teachers, now suddenly, a big group of them are coming to the hospital and being diagnosed with intestinal flu. What you would be thinking? You are trying probably to find the common denominator. So you will ask the questions, who, where, when, what, and so on. So what you will be probably targeting, trying to find out. Any ideas? So maybe if this was the summer, maybe it was the end of the school year, maybe they have some school trips or something like that, and to find out where they were going, what was the common denominator. So in that time, it was actually, they were going as a school trips to the specific area and, being in the water there. So you have to find out, and then you will find the location. and then you need to find out what is correlated with the location. So that was the problem with the not far the farm that was from that location, and that was the part that was doing this spread of that infectious disease. Another one, public health in Russia. So when the communist system finished back 1990, so now suddenly they, that was so-called like the democracy was developed, but it was not, it was like misunderstanding of that word of democracy in that former communist countries, and it was increased the crime activity, stealing and many of the things. So they have to put the people to the jail, but they didn't have that jails, developed and ready for so many of that people to have that in that time, and they didn't have also the sanitations and everything. So what was happening in that time was increased risk of infectious diseases, increased risk also of tuberculosis because of that jails, but also suddenly was increased risk because during the communist system, it was mandatory, everybody have to go for the screening, have the screening for tuberculosis, everything. After that, it was like this structure was somehow lost, and there was no screening about people, for the tuberculosis, infectious diseases. So there were a few different problems. One was the problem with getting, infection in that prison. So the people, if they were leaving the prisons after a certain period of time, or even a short period of time, they could spread the disease. Plus, there was no surveillance in that time. It was like completely breaking of public health infrastructure. So based on this, you can see that's quite important to have in proper way the public health infrastructure. What do you think about the life expectancies? That life expectancy was decreased so much in Russia. Any idea what happened probably in that time? It was, I think you cannot guess completely. Yeah, maybe you know. Yeah.
Maybe like all the problems that they're having were like long-term effects, so they didn't really see them until later.
Yeah. Yeah, exactly. And I know what you are thinking maybe, and I hope you are thinking, especially the environmental health, because during the communist system, it was, it was not properly done with the filters in the factories, and it was not screening done with the pollution. So now suddenly, as your classmate mentioned, it was the long effect. Another thing, suddenly it started, more people in that country started to smoke. So suddenly it was possible to have all the products from Western countries, so they just jump on the smoking. So especially Russia, Poland, Czech Republic, so now suddenly it was like 80% of population were smoking, and it was increased among men and women. So that was another, indicator for that. So if you are looking, and sometimes you would like to do and find out, is there any correlation with the behavioral and with the disease in the specific countries? Try to find out also what is the political situation of the country, what is maybe the geographical part, what is the historical part, and it changes at that because it can influence the behavior of the public and influence the outcome with the diseases. Of course, we have to also use the epidemiology for preventative things, for the bioterrorism. It's necessary to do the surveillance and to check. In that time, through that years, it was very important to check and providing the surveillance for the anthrax. So you probably remember that in the newspapers and all the information around you. So I wrote here at the end, it's like prophylactic antibiotic therapy. So this is the situation that you can imagine that there is the airplane, they are calling that yes, there is some kind of white powder in that board. So what you will do as a public health provider, so you will let probably the airplane to land, and of course you have to have that samples to send it to the laboratory. But in the meantime, because you don't know yet, you don't have immediately the results, of course you have to find out, locate all the people, where the people will be going, moving. and probably, because you don't know yet if it's real, the powder is the real disease or not, to do probably prophylactic antibiotic therapy, because you find out, well, it's better at this moment to apply the antibiotics or the specific medicine if it's low level of the side effects before you will get that information from the laboratory. If you receive the information from the laboratory, it's no correlation with the disease, so you can stop to use this medication. Now we will be talking about the father of epidemiology, and it's John Snow. So you need to know, it's like mandatory name to know this correlation with the cholera. So he did actually the first epidemiological process, and we are moving to London back 1815. And so, of course, there was the problem with the cholera. So he was thinking, like, how come one part of the London has the disease, another part of the London doesn't have the disease? So what could be, again, here are the questions: who, when, where. So he tried to find out why a portion of that city has the disease, other portion not. So he found out that was when he was doing and going, literally he was going from household to household. And he did a survey and asked the questions. And he came to the point that it's based on the water supply. Now it's, of course, now it's obvious. Now if you will see any kind of problem like this, you would be thinking, oh, maybe that can be correlated with the water, and I will just, check the situation. But in that time, it was the first time doing the natural experiment. So these, here is the table showing, like, yes, there were the differences between the specific area in the city that was the higher occurrence of the infectious disease of cholera, and other part of the city was not. So then what he decided, to close the water supply on this part, and just everybody move and taking the water from other places. And there was quite the solution for that epidemic situation. And of course, additional things you have to do, sanitations and all the part in that. But it's very important before that to find out what is the etiological factor in that. So if there will be the question, who is the father of epidemiology? Please, you need to know that. It's just the basic thing. The same like you know already, father of medicine is Hippocrates, and so additional fathers I will show you later. This disease, again, if you look on that, suddenly there are patients coming to the medical offices with fever, muscle pain, pneumonia, and because it's quite like new disease, so it's probably reported to public health department. And then the public health department, they maybe make the connections with other locations of public health department, and they found out suddenly we have 150 cases, situations that people have the similar symptoms. So what to do about that? What do you need to do? So ask the questions. What, where, when, okay? And so you find out from that questions that all of that people were in a certain period of time in the same location. So they were on the specific, they were in Philadelphia, they stay actually in the same hotel, and they were participating in the same conference. So if you find out, oh, there is some kind of, common denominator, you will go probably to that hotel or to that conference location, and you find out it's from the food, it is from the, what is the problem? So they found out it was from the cooling tower. So you have to do and provide, the cleaning of the cooling tower, and you learn, okay, this disease is connected with the cooling tower. So if any symptoms like this occur later, you are just, targeting this process. Another, Eosinophilia-Myalgia syndrome. So this was a situation that, again, people were coming with very unusual symptoms. They found out on the common denominator, because you have to develop the questionnaire, you have to ask people, you have to really go and ask with that patients that they have that problems. They found out that they were consuming dietary supplements. and it was tryptophan in that time. So it was not L-tryptophan on its own. This is very good. Actually, tryptophan is good amino acid, and you would like to have that because it's developing and synthesizing your serotonin level, and if you have serotonin a little bit higher, you have the smile and good mood. But that was because when you develop the tablets, there are additional components, not just the active. So there was some kind of wrong components that was added. So that was some kind of polluted part that was added to the component that was causing this syndrome. But now it's like, oh, that's easy. But it takes time before you will find out what is the etiological factor behind that. Another situation that was back 1981, it happened in Spain. And you would never guess that something like this can happen. And this because in Spain, in Mediterranean countries, they use the olive oil. So it's very common that, of course, they are using that on everyday basis, and they use a lot, so they need to buy a lot olive oil. So when there was somebody going from household to household and selling the olive oil for the good price, of course, everybody was buying that. So they bought that, but unfortunately there was not like the pure, nice olive oil. There was the industrial oil with all the toxic components. And people were consuming that and thinking that was the olive oil. So that suddenly they got, these syndromes. You don't know if you can have like just diarrhea, vomiting, or you have some strange like myalgia syndrome. Myalgia, it means really the pain in your muscles. From like nowhere, it's coming some kind of problem like that. So these are another things that you have to be aware, or I don't know if I was sharing that information, but a few weeks ago that was the problem with tinted actually the alcohol in Czech Republic. So suddenly people were coming to the hospital and being blind or suddenly dying, and so of course the blindness could be a little bit correlated. You already know there is the methyl alcohol correlated with that. But you have to find out who is selling the product and what's the situation. So be aware about that, because this, and again, you have to ask the basic epidemiology questions about that. This curve is showing to you what, through the proper way of learning about the process, about the diseases, and proper way of the education, proper way of the preventative approaches, primary, secondary, tertiary prevention, you can eventually, prevent or decrease the risk of the disease or the consumption of specific component that is correlated with triggering of different type of diseases. So this is about, consumption of cigarettes. Do you know that 2014 the UCI will be pronounced like smoke-free campus? Okay, surprise, surprise, yeah, but they have plans that already started. It took long process. The students also initiatives on the campus, and some of the campuses they are already smoke-free. So it's planned there 2014 that UCI campus will be smoke-free campus. Discussion questions? What do you think? Why is epidemiologic surveillance important for public health? Just like that. If there will be some question like that on the midterm, but it will be ABC or true and false. So how you will establish that question? What you will write? It's important. It looks like very simple. I don't think it's complicated. Just why it's important. What is that? Just prevent? Yeah, go ahead.
So with surveillance, you can ask, remember the 3 questions you put: who's getting disease, when are they getting it, and where is it occurring? Therefore, you can identify maybe a group of people, maybe with certain habits, maybe a certain area, and it would play a role in a bioterrorist attack, because then you can narrow it down to, is it just postal workers who are getting this? Is it people who drink a certain type of water? So, there you go.
Yeah, that's perfect. This is a great explanation from your classmate, and that very crucial word is to prevent disease. That's it. So I know you were thinking like this everything belongs to that because it's explanation of the surveillance. So that's excellent, and that all of these is leading to prevent the disease. Okay, so what has epidemiology contributed to people's understanding of heart disease or lung cancer? Don't try to find very difficult answer, just the basic one. What after the epidemiology? Remember, I was showing to you 1948 and 1952. What do you know about that? Yeah?
We're studying why certain types of people got these diseases and what kind of habits they participated in that led to it.
Okay, so exactly. So we know already lung cancer with the smoking tobacco, for example, or different things. And yes, what is the lifestyle modification with the heart disease? So that suddenly was possible for us to understand that. Yeah, you have some additional comments? Yeah, something similar? Yeah, of course. Okay. Clip on epidemiology. Can we do that? Yeah. Okay. So we have to go through the roadmap. Is that right? I would like to show you now. There are 2 links about epidemiology.
Dr. Soskolny, you are a professor of epidemiology and health sciences at the University of Alberta. And just as a general question, what is epidemiology and how does it affect us?
Epidemiology is the study of diseases as they affect populations, not just diseases, but generally the questions of well-being, social well-being, as they affect population groups or communities at large. The epidemiologist is more concerned with community, so you end up with a relationship between the epidemiologist and the community, or the city, or the country.
Why is epidemiology an important science in today's society as opposed to, say, 10 years ago?
Epidemiology has been important, certainly in the modern period, since the discovery of antibiotics in the 1940s, with the control of infectious diseases. Until the early 1980-81, to be exact, when HIV/AIDS came along, at which point people thought that infectious diseases could be laid to rest, they were well controlled. But since the 1980s, with the advent of SARS and now avian flu and the looming anticipated flu pandemic, infectious diseases are again preeminent in the focus of epidemiologists in the world. But I believe that epidemiology has always been critical because what it does is it bridges the basic sciences with public health, with the health of the communities.
Epidemiology seems to encompass many different topics. You mentioned science and healthcare. Where does climate change fit in? How does climate change affect human health in general?
If you consider that if the air we breathe is unhealthy and the soil that we grow plants is incapable of generating or contains all kinds of hazardous substances and toxic substances for people, and the water quality is inferior, then the public's health is in grave jeopardy. I mean, so much so that you will see extinctions of large communities or the elimination or the illnesses in communities on a massive scale. And the job of the epidemiologist is to ensure air, water, and soil quality. So when you ask the question, how does climate change affect us? Well, as we tamper with the very fabric of our environment that constitutes the habitat that we are part of, as the habitat changes, new niches will be found for all kinds of species of pathogens, bugs, creepy crawlies, call them what you will, that will potentially affect human beings.
What effects are we going to see and how long will it take to set in?
The question you ask is a very interesting one in that that really is the kind of work that I've been engaged in with the World Health Organization, among others, for the past decade, trying to anticipate how long we've got for major declines or major thresholds in these ecological systems that we depend on for our very sustenance to sustain themselves. If these systems flip, as people at the University of Alberta have shown systems do, and other ecologists and biologists around the world have shown, if we keep pushing the limits of what nature can withstand from our infinite greed and consumptive lifestyles, and what are we individually and collectively as a society willing to do to try to contain the damage that we have caused already to the environment and to these different ecosystems around the world.
Perhaps it seems in some people's minds it's easier to be unethical towards an ecosystem than another human being, but in fact, these unethical decisions that we're making are having a direct impact on our very lives, on our daily living.
Well, worse than that, in my view, is perhaps we can be short-sighted enough to say, well, you know, I've got to have a job today and the economy is all important today. But when we think about what the impact of this is going to be on the children of today and on future generations, that's where I like to call myself an advocate for the environment, as ecologists and other biologists and types like us would be in the world. And, you know, we need advocates for children, because children can't speak out about the potential for the disastrous future, the calamitous consequences of what we're doing for their sustenance and their ability to have children, and the effects of the pollution on their genetic material for their children. These are things that already are going on. It's a question of for how much longer it can go on. The role of epidemiology is preventive. We believe that the advice that we give is to take the safest course of action so that we are not faced with infiltration of any kinds of chemical pollutants or toxins or poisons of any kind that could affect the water treatment facility. If you think about potentially some level of contamination hitting the Rossdale water treatment plant and they being unaware of it, and that this should go out and cause illness in 10 people, 30 people, this causes a huge burden to the healthcare system in terms of what ends up in hospitals. So our job is a constant one. We're constantly in tension with economics or with other perspectives on what might be a better solution.
Okay. And okay. So, and I would like to show you one more about epidemiology. This is like funny one, okay? So you will remember it's short, 2 minutes. Just before it will load, so I can talk about, you know, you probably noticed there are different,
And there's been an experiment which I think reflects pretty well the characteristic of the profession. And I'd like to tell you about this experiment because it allows you also to situate yourself, you know, with respect to epidemiology. This experiment was the following. It was, you know, a researcher thought, you know, how can we define epidemiology? Well, epidemiology is what epidemiologists do. So imagine the following experiment. He took a room with a surgical table and he put a can of sardine on the table. And he asked a neurosurgeon, a pathologist, and an epidemiologist to come. And the experiment was very simple. They had to go into the room, do whatever they wanted, but they had to come out with a report. So the neurosurgeon went first, stayed 2 minutes, came out, he had written can of sardine on his paper, and the box of sardine was very nicely open. There was not a drop of oil on the table, and he didn't care about looking at the sardines themselves. Then goes the pathologist, stays half an hour, comes out, is full of oil everywhere. The can is roughly open, you know, very strangely. There are bits of sardine all over the table and oil. And he has a 2-page report. This was a metal can, and I opened it according to the procedure of so-and-so. There were 6 sardines. I opened them all. There was nothing pathological, and I think it was, you know, safflower oil or something like that, sunflower. So he gives his report. Then goes the epidemiologist. The epidemiologist stays 8 hours. So the guy I saw was starting to get worried. After 8 hours, the epidemiologist opened the door. He looked exhausted. So immediately the guy looks at the table and sees the can of sardine untouched. But the epidemiologist had a 20-page report on how to estimate the number of sardine in the box without opening it.
Okay, so did you like that too? So these were some comments about epidemiology. The one of the serious one also a little bit the funny one. I know that in the previous slide I was showing like the words about epidemics, about pandemics, and about endemics. So mostly all of these words are correlated with the location and with like how huge is the problem. Epidemics on its own is like epidemic situation, so it's going like infectious process, or it's you use that, originally it was used with the infectious process, but it's used also for the chronic diseases. When you will have the guest speaker on Thursday, she will be talking about the epidemics of diabetes. So it means that you can check that more people have that diagnosis and the same symptoms and problems with the disease. So epidemics, the definition on that, it's like more people having that same disease, that same problem. When we talk about endemic, so it's the specific location, it's located, so maybe this and this specific disease is located in the coast of Africa, for example. And pandemic, so when we talk about the SARS, or when we were talking about the H1N1 flu, so we were thinking, oh, this will be pandemic, so it will be in the whole global level. So they are like the basic, information about the specific, the words on its own. Now a little bit we have time to go to the epidemic principles and methods. It's a little bit the review that you already saw that, so I will be not going too much to the details again about epidemiology on its own, but you need to know like the basic, you already have now idea what is epidemiology. So you are actually defining the type of the disease, you are trying to find the determinants of the disease, frequency, occurrence on its own. So this is the epidemiology on its, like when we talk about that. Some additional things, like how you define the disease. So this is something that the disease, they have the same symptoms, they have the specific components if you do laboratory tests. So the laboratory tests are typical that findings for the specific disease. So that's very important. Also, if you would like to verify the disease, like example you saw on the video clip, you have to do the laboratory test, the blood test, or if the pathogen is correlated with that. So that it's for the definition of the disease. So it's quite unique thing that is defined by laboratory tests, by symptoms, the complex things together is defining the disease. And of course, very important is also the frequency. What you need to know is incidence and prevalence. Incidence just on its own, it's telling me like, oh, this is the first occurrence of the disease. So it means how many of the new cases or new situations they are occurring during the specific defined period of time. Prevalence, it means that they are still the existing cases. When we will be talking about the eradication of the smallpox, so we will be talking also about the incidence and prevalence. So prevalence, it's like still the old cases you have there. When you study about the disease, what is very, very crucial for epidemiologists is the incidence. You would like to decrease the numbers, the frequency of incidents. So it means if still you have the new cases, new situations, new people sick with the disease, it means still the program didn't work enough, or still you were not able to conquer the whole process. So the word, the names of that like incident, this is something that quite crucial. You would like to decrease that as much as possible. Again, when we talk about prevalence, so there are already existing scenario of the disease. So the prevalence depends on incidence. So if we have new cases, then eventually in the long run they become as numbers in the prevalence. And also it depends on the prognosis. So if you have the people that they are able to be completely healed from the disease, or there is a very severe disease that people are dying from that. So that's the prevalence is depending on these two components. Distribution of the disease, I mentioned that already, so you are familiar with this. So that's the questions that you ask during the epidemiology process. And for the determinants of the disease, I mentioned that also before, that you need always to find the risk factors and why we have that disease. What is the problem? Why we have that disease? Epidemiology is connected with the human population, so we check the trends of that human population diseases. Kinds of epidemiologic studies. This is something that I would like to spend a little bit more time on that. So we have, and I already mentioned that. I was telling you like, oh, Framingham study, and we need to find a little bit more about the specific disease, so we will go retrospectively. So we have intervention study, cohort study, and case control study. Again, when you will have class completely on epidemiology, you will go into detail, you will be doing the calculations. Here you just need to know the basic information about the specific studies. The studies can be prospective or retrospective, and it depends also in which group of that studies the epidemiological studies are. So intervention study. Intervention study on its own, the word intervention, it means intervene. So it means that you will start with two groups. One will be the experimental group and one will be the control group. And experimental group, it means that you will be intervening, and I will be sharing with you information about the headaches. So if we know what are the factors, etiological factors, that they are correlated with the problem of the headaches, we can intervene the population. So it means that we can do the health education and intervention part, that we will recommend public to eat maybe low dietary fat intake, or eating more fruits and vegetables. So that portion that we will give them recommendations, it's intervention. So one group will have intervention and other group will not have anything. So then we will comparing that. So that's the intervention study. Also, when you will do the study, you have to try and to find out that they are the groups, they are very similar. So it's based on the age range, also having the problem or symptoms when we talk in case about the headaches. So they will have the similar frequency of occurrence of the headaches. And so then you will be comparing. Sometimes what can happen is also you can have study that you don't have the control group, so it means that intervention group is on its own control group. So it means that you have the baseline, you collect the data, and then after 4 weeks or 8 weeks, you will establish the intervention program. You are intervening and you are comparing what happened 6 weeks or 8 weeks in that group. So you have the baseline, which can be like the control group, and then end situation after that. So I will finish on this level with this slide, and we will go more deeper later on next time. So I am letting you go under one condition. What is that? Smiling. I don't see smile, laughing. I would like to have cheese, the whole class. So smiling, okay. Be sure that you do breathing, because you are sitting here, you probably do shallow breathing. You need to have more oxygen. And walking, running maybe to the next class, or just going the brisk walk, okay. So to be in good health, we will continue. Would like to see the smile. Okay.